USMLE style question, subdural hematoma. A 72-year-old man with a history of hypertension and chronic alcohol use is brought to the emergency department after a fall at home. He was found unconscious for a brief period, but regained consciousness before paramedics arrived. On examination, he is confused, with slurred speech and a slow response to questions. The patient has bruises on his forehead and mild tenderness over the right side of his skull. A CT scan of the head shows a crescent-shaped collection of blood compressing the cerebral cortex, but no evidence of skull fracture. Which of the following is the most likely cause of this patient's condition? A. Rupture of middle meningeal artery. B. Rupture of bridging veins. C. Rupture of anterior communicating artery. D. Intracerebral hemorrhage. E. Subarachnoid hemorrhage. Answer B. Rupture of bridging veins. Explanation. Subdural hematoma, SDH, is commonly caused by tearing of the bridging veins that cross the subdural space, typically due to trauma. The hematoma collects between the dura mater and the arachnoid mater. Characteristics: crescent-shaped collection of blood on CT scan. Slower onset of symptoms compared to epidural hematomas, which have a lucid interval. Symptoms may evolve over hours or days. Older adults, particularly those with chronic alcohol use or brain atrophy, are at higher risk for SDH due to increased susceptibility of bridging veins to tearing. Why other choices are incorrect. A. Rupture of middle meningeal artery. This leads to an epidural hematoma, EDH, which typically presents with a biconvex, lens-shaped hematoma on CT and is often associated with a lucid interval before neurological deterioration. Rupture of anterior communicating artery causes subarachnoid hemorrhage, SDH, which typically presents with a thunderclap headache and worst headache of my life, not a crescent-shaped hematoma. D. Intracerebral hemorrhage. This type of hemorrhage occurs within the brain parenchyma, typically due to hypertension or vascular malformations, and appears as a diffuse or localized hyperdense area on CT. It is not typically crescent-shaped. E. Subarachnoid hemorrhage, SAH, caused by rupture of aneurysms, most commonly at the circle of Willis or trauma. It typically presents with sudden onset severe headache and blood in the cerebrospinal fluid, CSF, not a crescent-shaped collection of blood on CT. Clinical relevance. Symptoms of SDH: confusion, slurred speech, headache, or focal neurological deficits, depending on the location and size of the hematoma. Risk factors: older adults, brain atrophy makes the bridging veins more prone to tearing. Alcohol use increases risk of falls and causes brain atrophy. Coagulopathies, or medications like anticoagulants. Treatment: small SDHs may resolve without surgery, but large or symptomatic SDHs often require surgical evacuation, e.g. craniotomy or burr hole. Monitoring for neurological deterioration is essential. Would you like to dive into management strategies for head trauma or another related topic?